like to take this opportunity to acknowledge the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy, comprising the Siksika, Piikani, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to Métis Nation of Alberta, Region 3. The Summer Wellness Series is presented in partnership with the Taylor Institute for Teaching and Learning and the Campus Mental Health Strategy. Please note that this webinar will be recorded and published online to be viewed afterwards. Please feel free to use the chat box during the presentation to ask questions. There will be time at the end for Q&A, and we'll do our best to answer as many questions as possible. Please note that the chat box is private and can only be seen by the event host, so your questions will be asked anonymously. Please direct all questions for Dr. Dobson to the Chancellor. All microphones and videos are turned off except for the facilitator to facilitate your webinar experience and to ensure it's not disrupted with other video images or sounds. If you unmute and speak into your microphone, your voice will be recorded. At this time, I'd like to introduce our moderator for today's session, University of Calgary Chancellor Deborah Yedlin. A long-serving community leader and Calgary journalist, Chancellor Yedlin recently joined the Calgary Chamber as President and CEO. Chancellor, we are thrilled you could join us today. I'll hand things over to you.
Thank you, Melissa, and it's great to be here and to be the facilitator for our today's session with Dr. Keith Dobson. Dr. Dobson is a professor in UCalgary's Department of Psychology and a clinical psychologist with expertise in cognitive behavioral therapy. He's a widely published author, and his recent focus of work, which is extremely appropriate given the current landscape, is about the stigma related to mental health disorders, especially in the workplace. This is our third session with Dr. Dobson that we have been holding since the beginning of the pandemic. And every time the session is over, not only have we had many questions that we were not able to answer because we ran out of time, we all were encouraged by his remarks and his insights and the framing of some of the questions and answers that were presented to him. So really looking forward to hearing Dr. Dobson offer his remarks and his thoughts on this current subject. So I'm going to turn it over to Dr. Dobson, who's going to make a presentation, and then that's when we'll start the Q&A. Over to you.
Well, thank you very much. I was going to say that we should stop meeting like this. Unfortunately, the pandemic continues, and it's important, of course, that we all pay attention to our mental health. So the presentation today is really focused on getting ready for the new academic year. It's been geared, as I've been preparing it, for people that are involved at the University of Calgary, of course, but also would be highly relevant to people who are having children go back to school, people who are just in holidays now, and then will be starting their work again in September. So basically, it's sort of the start again of the September time and return to work, return to school. I've really addressed it to both audiences to some extent. What I'm going to do, and again, my email is here, and if people do have interest afterwards, if they have questions, I know this will be posted, but if they do have questions, you're welcome to email me, and I'll do my best to actually respond to every email I get. So just to offer that. What I'm going to do in the time I have is very briefly talk a little bit about mental health and mental disorders so that we have some common language. I'm going to focus a lot on coping resources and strategies that we can adopt at this time or in general. I'm going to have a brief presentation about resources that are available to people at the University of Calgary and elsewhere. And then we'll have, of course, the Q&A session that you talked about. Just want to also give a quick note that some people may notice themselves or someone that they know in the discussion today, and that's fine, of course. I mean, if you do see some signs or symptoms of distress that are mentioned, that's a good clue. Then you should be either adopting some of the coping resources we'll be talking about or some of the strategies. So again, I don't see that as a problem particularly, but just a note basically. So with that, let me just introduce a few basic concepts so that, again, we're sort of using the same language. The Health Canada, which of course is our federal government agency that deals with health, has a definition of positive mental health and mental illness or mental disorder, as I'll talk about. They talk about positive or good mental health as being the capacity to feel, think, and act in ways that we enhance our ability to enjoy life and deal with challenges. So one of the key elements of this definition right away is the ability to deal with challenges, which of course COVID-19 presents an enormous one. Resiliency is another term that sometimes people use to talk about positive mental health, the ability to bounce back when there's adversity or have problems. Some of the signs of good mental health include feeling well or feeling positively, knowing that you can cope with difficulties or actually seeing yourself cope with adversity that happens, achieving personal goals, and then feeling socially connected. And again, these are sort of the hallmarks, if you want to think about it, of good mental health. We recognize, of course, that from time to time, people's mental health may start to slip. So there's a definition again from Health Canada that poor mental health can be seen through declining signs or symptoms, but not where a person actually has a diagnosable mental disorder. So some of the signs or symptoms we might see are trouble sleeping or eating, difficulty concentrating, feeling moody or irritable, or having unusual emotional experiences, or again, the inability to cope with ongoing life stressors. It's important to note that almost everybody at some point in their life will experience some decline in their mental health if these stressors are sufficient. And there's good reason to believe, of course, that many people right now are having this experience, unfortunately. Health Canada does say, and we do believe generally, that poor mental health can be resolved, again, if people engage the proper resources or their proper coping ability, which again, I'll talk about a bit later. And then at the far end of the spectrum are mental disorders, or what are also called mental illness. And again, we have different diagnostic frameworks that exist. Psychologists, psychiatrists, physicians can provide mental health diagnoses. And again, we're looking here at the far end of the spectrum. It can include a whole wide range of disorders. And again, we look at them from a comprehensive perspective, looking at the signs and symptoms that people have in order to make or not make a particular diagnosis. Some of the common conditions that we have in Canada are major depression or major depressive disorder, as it's more technically called, generalized anxiety disorder. This is only one of a series of anxiety disorders that people can have, but this is where people feel generally anxious. And this would be different, for example, than health anxiety that some people could have around specific health concerns, or social anxiety, where people feel concerned about being in social contact with others. And then the other common one that we see in adults in Canada is substance use disorder. And of course, there are many substances that people can potentially abuse or use. Alcohol, of course, is the common one that we see in Canadian society. But what we're looking at here are conditions that are strong enough to affect day-to-day functioning, and something that would be usually experienced as something quite different than normal experience. It's been estimated that 1 in 5 Canadians will experience a mental disorder within a given year. But again, bear in mind, there are literally hundreds of diagnoses, and some of these will come and go, and others tend to be more stable. This data on this slide is actually one of our more recent prevalence studies of the rates of mental disorders in Canada. This is on adults, or the survey of adults. And again, this is looking at the end of the spectrum, so people that are struggling. And these are the 4 most common diagnoses that were seen in the study that's cited here. Major depression being the most common single disorder, with an annual prevalence of about 5%. Alcohol abuse, about 4.4%, generalized anxiety, 2.6%, bipolar disorder, 1.5%, and then other disorders running down. But as you can see here, anxiety, alcohol abuse, and major depression are sort of 3 of the most common. Please note that this was pre-pandemic days, of course, so the estimates have to be taken with that in mind. It's also based on formal diagnostic criteria. So this will become important in just a minute. This data is actually prevalence data from the University of Calgary. So this is based on data from the National College Health Assessment Survey. It's based on self-report data. So I take it with a bit of a grain of salt because self-report studies tend to give us somewhat higher estimates than other kinds of studies. But again, you can see the common kinds of conditions for students at the University of Calgary in the pre-pandemic days were anxiety, depression, panic attacks. And then again, you'll see a range of other conditions with lower rates. But again, suggesting again that quite a number, and again, approximately 1 in 5 university students, possibly even somewhat more, experiencing one or another mental disorders in a given year. So as a base rate. Unfortunately, with COVID-19, we've seen an increase in these estimates. So this slide presents data from the United States, but it's a well-done prevalence study looking at rates of depression, both pre-pandemic and then in the period just as the pandemic began. So actually approximately last summer. And again, it's a bit of a complicated slide, but the green bars represent the rates of depression at different levels in the pre-pandemic period. The red bars representing those in the post-pandemic period. And you can see the sample sizes are reasonably large, about 5,000 people pre-pandemic and about 1,500 in the post-pandemic period. And you can see based on this study, and again, it used a well-developed prevalence measure, the estimates of depression pre-pandemic were about 9%, and the estimates of actual diagnosable levels of clinical depression were about 27% in the post-pandemic period. This study is a little bit higher than what we're seeing on average. Generally speaking, the estimate is that rates of common disorders have doubled approximately during the post-pandemic period. But it's also important to note that they're not stable. They don't stay the same at that same rate. So this study, for example, was done through the Center for Addictions and Mental Health in Toronto. One of the nice things that they've done is they've done recurrent surveys, quick surveys of the population, approximately 1,000 people at each of the different assessment points. And so what we can see here are rates of anxiety on this slide across time in Canada. And what we can also do is look at the rates for different age groups. And as you can see, again, I don't know how easy it is for viewers to see, but the age makes a difference. Younger people tend to have higher self-reported rates of anxiety. People in the 40 to 59 year range, somewhat lower, and people in the 60 plus range having the least. Another interesting thing here, I think, is that you'll see that the levels of anxiety actually shift across time. And I think if you were able to go back and look at the first, second, and third wave, you'd find that, in fact, these numbers tend to follow along. So anxiety does tend to be a fairly responsive kind of emotional response. When there's a life stressor or an issue, people become more anxious. We'll talk a bit more about that in a moment. In contrast, these are rates of depression. And these seem, again, to bounce around a little bit. They went down last summer, and then they've stayed pretty high since then. Again, same pattern though, that younger adults seem to have higher reported rates of anxiety. The people in the age 60 plus actually having lower, and it appears somewhat decreasing rates of depression. Sorry, this is a depression slide. Rates of depression as the pandemic has continued. They also survey issues such as loneliness, substance use, and again, not surprisingly, they tend to follow along much the same pattern with younger people reporting higher rates of loneliness, higher rates of substance use, but again, pretty stable and pretty high, approximately double relative to what we see. I just saw a recent study that was published in the Journal of the American Medical Association, JAMA, with children. And again, it's been estimated there that rates of anxiety disorders and depression are at approximately double what they were in the pre-pandemic time globally. So again, this doesn't seem to be just true in Canada, but sort of a universal trend. One way to think about mental disorders or mental illness is as a continuum. I've already sort of been hinting at this from what Health Canada said. And the mental health continuum model has been adopted by the Mental Health Commission of Canada. It's actually used in some of the programs at the University of Calgary. But what it says is that we can conceptualize people's functioning from being healthy at one end of the spectrum or continuum to being ill, and ill being, of course, diagnosable mental disorders or or diagnosable condition. But in the meantime, we have people who are potentially reacting to different kinds of conditions, such as COVID-19 or the stresses associated with COVID-19, or potentially even moving into what we call the injured level, which would be where people are actually seeing more severe functional impairment, not quite diagnosable, but certainly at the level where they might benefit from some kind of assistance. This continuum model has been broken down into a number of different categories, and I'm not going to go through this just partly because of the detail, but it's important to note again that we can look at things like mood or behavior or coping strategies. And as we move across the continuum, you can see various signs or symptoms that reflect different levels of healthy through ill kinds of coping or responses. Also important to note, of course, that people can have different responses at different levels on the continuum model. So for example, you could have somebody who's having quite disturbed sleep, but in other respects is functioning fairly well. So again, there can be some asynchrony of different signs or symptoms. So when we use this particular model, we just ask people to stop and think about their most recent experience, roughly the last week or so, and think about how are you feeling, how are you functioning, and look at the signs and symptoms you may be experiencing, and then put yourself into the rough category of where you are. The other thing worth noting is that some people normally function in the yellow zone. For example, they often have some difficulty sleeping. They may have reduced social activity, for example. So this may be their normal level of functioning. And if that's true, that's not particularly problematic. What we get more concerned about, of course, is when we see shifts. So when people are moving towards having more problems or more signs and symptoms, this is when we start to think that, as in particular, there may be the need for some kind of action or intervention. We also know that not everybody gets the care that they need. So stigma, as you mentioned in the introduction, is one of the things I've been working on. Stigma can take different forms. It can be public stigma towards negative attitudes, behaviors towards other people who might be having signs or symptoms of mental health challenges. It can also be self-stigma, where the person blames or criticizes themselves, or maybe doesn't give themselves care as a way of coping with their negative signs or symptoms. So stigma can take various forms. Other barriers to care can include lack of knowledge. So if people don't know that what they're seeing is a mental health sign or symptom, they may not take the appropriate action. The cost may be an issue for some people if they don't have access to resources because they can't afford them. The resources may not be available in a timely manner. In fact, we know that there have been several studies in Alberta of mental health resources and that they were generally deficient before the pandemic. And there's no reason to believe they're any better really in the post-pandemic or the pandemic period. So access to resources in a timely fashion can be an issue. And of course, then people need to be able to get to those resources in a way that makes sense. So if a clinic is only open, for example, from 9 to 5, Monday to Friday, that may not be appropriate. So looking at how those services are delivered is an important issue. There have been a number of advances in this regard during the pandemic. And in fact, I have to say one of the ironical benefits, I think, of the pandemic is that there's been a real shift to providing online or distant mental health services. So people can actually get access to services in ways that they couldn't before the pandemic, because typically pre-pandemic, these were almost all done face-to-face in person as meetings, whereas nowadays there's much more phone or web-based kinds of interventions, which certainly is a benefit. So there have been some things, some ways of coping with the pandemic that have actually been somewhat positive. So as a summary of what I've just been saying, mental health, mental disorders are best considered as a continuum. So rather than as a categorical kind of state, being healthy or ill, it's best to think about things on a continuum. We also believe within the mental health field that people can move up or down the continuum based on stressors that they face or based on the application of resources. So if somebody is diagnosed even, we believe that they can recover if they're given the proper resources, especially if those resources are given in a timely and efficient manner. We need to identify any barriers to care as soon as possible and try to address them as meaningfully as we can. Because again, there's sound evidence over many years that the earlier a condition is identified and recognized and provided care, the better the response. So early assessment, early intervention, just as in many areas of health, is also true for mental health. Now, in terms of the return to work and school, given all of what I've just been saying, what can we add? A couple of things, I think. I know we've talked about this in previous sessions, but the major psychological predictors of anxiety are threefold. It's unpredictability, uncontrollability, and salience or importance of the event. So basically, we become more anxious if we don't know what's going to happen. We know something bad may be coming down the line, but we don't know what it is exactly or how bad it's going to be. Even if we know what it is, if we can't control it, so we don't have effective coping strategies or don't have effective ways to respond to the situation, it's going to increase anxiety. And then third, if it's something that's high importance, so something where personal health is implicated, the health of children, the health of loved ones, and in the case of COVID-19, of course, even potential long-term health effects or death as risks. So it's not surprising that every time there's a new wave with COVID-19, we see a lot of anxiety because it's not clear what's going to happen. Our coping resources, frankly, are somewhat weak. We can take vaccines, of course. We can mandate masks or use our masks. We can engage in physical distancing, but these are relatively weak responses to a potentially lethal threat. So not surprising that people would be feeling anxious. So again, especially at times when we're changing our way of coping, so when public policies change or when the life circumstances change, such as in the return to school, you would normally expect anxiety to go up, and that's exactly what we're seeing. It's not surprising. Our general advice, of course, is to maximize predictability as much as possible. So, pay attention to good public health advice, maximize controllability by following that public health advice. So getting the vaccine, for example, wearing a mask in public situations, engaging those public health standards that are recommended. And we should, of course, unfortunately recognize that this information is going to change and that we need to maintain some level of predictability by watching what's happening and paying attention to the best advice we have. We also need to be mindful that there are different kinds of signs or indicators that might pop up in the context of return to school and return to work. Again, I'm not going to go through all of these because of time, and I know they will be available after the presentation is finished. But basically, you can see people potentially engaging in different kinds of responses, which may be unusual for them at this point in time because, again, of their own stress and anxiety or their way of trying to cope with the problems that they're facing. So for example, if you see a change in mood or you see somebody suddenly becoming more withdrawn or isolated, or if you see that the work that they're doing is just not as effective, these can be signs or indicators, again, that the person is struggling, and it may be a sign that some kind of help is necessary for this person to maximize their ability to cope. In the context of the academic work setting, we may see problems in the work that students turn in, for example. We may see potentially conflict or excessive demands in some cases. We could theoretically see incivility or problems in the ways that people relate to each other. And in some setting, you may even see increased accidents. Again, I think at the university setting, it's not that likely, but theoretically it could happen. One of the general things I'll just mention here is that oftentimes when people are struggling with coping with stressors, their first response is to freeze or to move away. Again, many people have heard about the fight, flight, or freeze reaction. And when we get faced with a new stressor, often our first response is to stop what we're doing, look around, look for information to figure out what we should be doing, and potentially freeze for a period of time. So again, isolation, pulling away, avoidance are very typical signs. So this is something that, again, people might look for. If you see some signs, again, our general recommendation is to take action. And again, this is written here as if you're seeing the signs in other people, but I'll just mention that you can also see the signs in yourself and also take similar action. But again, the notion is that you should identify the issues as soon as possible. If you're meeting with somebody else, if it's a friend or a family member or a student, then, if you're a faculty member and you see a student who's struggling, let them know that you want to have a private conversation with them as much as possible. Let them know how you're seeing them, so in what role you're seeing them. Tell them what you've seen. Don't make inferences, don't make conclusions or draw conclusions about their mental health state generally. Just let them know what you've seen. Offer help. If there is stigma present, for example, if they feel that they don't deserve help, try to address that as much as possible, and then engage resources. And again, I'll talk about resources in just a few minutes here. But again, I think it's a responsibility that all of us have, that if we recognize distress in others, and if we're trying to develop a caring, compassionate campus, that we will actually let people know that we're willing to support them and make resources as available as possible. If you do take this step, again, a general piece of advice would be to follow up. You let the person know that, this was not a one-time interaction, but you actually want to demonstrate your caring by following up. Just a couple more things I want to talk about. One is coping strategies. Again, I've been hinting at, some coping strategies. And one of the things that we know is that most people manage most of their stressors most of the time. People are generally pretty resilient. And in fact, one of the ironies, I think, of situations like COVID-19 is that we can't really know how resilient we are until we're faced with a true stressor or difficult situation. And again, one of the things that's been written about a fair bit is how resilient people have been in general with COVID-19. We also know that no single strategy is going to work for everyone. And again, not all situations are the same, so no single coping strategy is going to work for every situation. Most of us have 3 or 4 sort of go-to strategies that we adopt amongst the whole wide range of different coping strategies that exist, and that's fine. As long as they work, of course. And so what I would encourage people on the call to think about is if your coping strategies are working, and if not, or if they're maybe not working as well as they could or should, to engage others. And again, there are a number that are available. Generally speaking, also, we believe that problem-oriented coping is typically the best strategy. And what I mean by this is, as opposed to avoidance or stepping away from problems, approaching them, trying to look at what the nature of the problem is, figuring out what resources you can draw towards it, and then engaging those resources. Here's a few tips. Frankly, these are, again, coping strategies that you can potentially adopt if you're not already doing them to take best care of yourself. And I'll just go through this relatively quickly because I know, again, that these will be available afterwards. But think about your body and your physical energy. Think about how you're functioning physically, basically. If you're not going to bed regularly, that's best advice that you should be doing it. And generally speaking, most people don't get enough sleep. So if you can, try to figure out a strategy to get longer sleep and, if possible, better sleep. But again, from a quick advice perspective, one of the things that we often recommend is that people set a regular time to get up in the morning, and that they use that week in and week out. And then, of course, they can vary their go to bed time if they want to. But again, maintaining a regular or relatively regular getting up time is important. Try to eat more healthily, smaller food portions, healthy food, fewer carbohydrates. We know that people, when they're stressed, actually tend to get a bit of a charge from having carbohydrates. Of course, these are sugars, so they increase the short-term energy, but unfortunately, they lead to longer-term problems. So, drink more water. If you can, engage in regular cardiovascular activity. Again, we recommend typically at least 3 times a week. The level of intensity can vary, of course, and the activity itself can vary, but something that gets your heart rate up, gets you breathing a little bit heavier. So it could be a walk, it could be running, it could be, basically whatever you like, but some kind of regular cardiovascular activity is good advice. And then taking breaks. Again, we all know about, of course, COVID, how we've been on Zoom meetings endlessly, it seems sometimes. So it's important every now and then to take a break, get up, walk around, maintain your physical well-being. Emotional, emotional awareness and emotional well-being, again, is critical. And we know that our emotions over the last 18 months or so have taken a beating. So some of the things we recommend are paying attention to your emotional state, sort of stopping and doing a sort of a check-in. If you're stressed, you can practice abdominal breathing. Some people find this very helpful as a quick sort of way to reduce arousal. Other people may use other techniques like yoga and so on, but again, what doesn't really matter as long as it's something that helps you to effectively cope with your emotional state. Paying attention to the way you talk to yourself. If you find yourself saying things that are negative or predicting negative things, again, trying to challenge yourself and see what's a reasonable coping strategy or coping way to talk to yourself. And then practicing appreciation. We all have things that we can be grateful for. So again, paying attention to those things and saying them to yourself can be helpful. Focus. We've all heard these recommendations over the last year and a half, trying to reduce multitasking, making sure that you can do one task at a time, hopefully to completion, but if not, at least getting a reasonable movement on it, minimizing your distractions, prioritizing your work. Good piece of advice is to schedule activities that are more challenging when you're feeling more fresh. So typically in the morning, but different people have, again, different ways of coping. And turn off your electronics at least 1 hour before bed. And I would even suggest more than that. For example, my general advice is don't pay attention to the news every day because there's not that much new typically. And so again, if you're paying attention to and tracking COVID numbers, that's probably not going to help your mental health. Some final things are to think about, again, meaning and value in life. And of course, this is important during times like this, but they're important anytime in your life. So think about the things that are important to you and then try to align your action with those values. Find what you get energized by and try to schedule the time to do those things. And it may be things that you don't know. I know many people during COVID times have had extra time because of physical distancing. And so they've discovered new activities and hobbies. So again, it's not too late to do that. Unfortunately, it appears we're going to be with COVID-19 for a while longer. So this is still an opportunity for us. Think about the people who matter to you and spend time with them. Again, physical distancing has been a real problem. I've always said during pandemic that we should never talk about social distancing. We should only use the word physical distancing because that's the public health guidance. We absolutely are social animals. We absolutely need as much contact with others as we can. Take your time, your vacation time, your down days. Don't work if you don't have to in the evenings or weekends. Again, protect your personal time and use it maximally. And basically find what rejuvenates you and if you can, do it. So there's a lot of quick advice, some of it very easy to say, not so easy to implement, but again, things that potentially could be used by some people. Finally, I just want to note that, again, the University of Calgary has a lot of excellent resources for different people. The campus mental health strategy was one of the first developed in universities in Canada. It began in 2015. It's been active ever since. We have a very well-developed campus strategy for students, faculty, and staff, and for visitors even to the university, and it's under ongoing implementation. With it, the student wellness services have been adapted, and modified. And of course, with COVID-19, some of the services that are available for students through the student wellness service have also been changed or modified. So there's a well-developed student wellness services on campus. You can go to their website if you're interested, if you're a student who's watching this and wants more information. We also have resources on campus and off campus of various other types. So for example, here is the staff wellness number on this slide. There's the website as well if you want access to it. I also want to mention that there are many, many workshops that are being offered on campus for faculty and staff. Some are for students, but I'm thinking in particular now for faculty and staff. The website is on this slide, ucalgary.ca mental health events. And again, you'll find if you go there that there are a number of upcoming talks again about the return to campus for different groups. And then into September, there are many different workshops around coping and different strategies, mental health strategies. We also have access to off-campus resources. So Homewood Health is our available EFAP, Employee and Family Assistance Program, so people can take advantage of it. And then the other number I'm going to mention on here, which we all should know in Alberta, is 811. 811 is the Health Link number. It gives you access 24/7 to nurses who can actually do an assessment and if appropriate, can refer you to appropriate services through Alberta Health Services. So again, this is a number that's relevant, not just for mental health issues, but for all health issues. So again, a number we should all know. And of course, we have access to our family practices, walk-in clinics, emergency services if necessary. So that's a lot of information. I imagine there may be some questions, but why don't we maybe move from that to the point of discussion?
You're absolutely right, Dr. Dobson. There is a lot of questions that have come in, and certainly there have been some great points that people want addressed. But let's start with how we prepare to that transition to being back on campus. Whether you're a student, a faculty, or a staff cohort, what would you suggest in advance of going back to the campus?
Well, I would recommend many of the things that we would normally do in the pre-COVID days. Things like thinking about what your activities are going to be, making contact with people who are important to facilitate your return to work. It could be things for faculty and staff, things like getting access to rooms again. So some rooms have been locked down or closed for a period of time. Making sure that the services you require are available. So it could be mail services, it could be computer services. Again, there's a wide range, but as much as you can anticipate those and engage those resources early, the better. I think, again, what you want to do if you can is talk to your manager again. Pretty much all of us on campus have somebody we report to. And so think about who that person is and engage with them so that you can find out from them best advice. And then the last thing I would suggest is pay attention to what's happening on campus generally. There's been a lot of recent information, for example, about COVID protocols and the return to work. And so again, I would just try to track those things. Again, a lot of this information is available on the university's website, so you could track that. Again, my own sense is that a lot of this information is movable, will change between even now and September. So don't look at it once and think you've got the most current information. Go back to it if you need to.
And I guess the other thing is that, do you recommend a dry run? If you're a student, do you recommend going to campus, picking a time when you're pretty sure that it's pretty quiet, and just going and walking through your class paths and figuring out where you're going to perch so that you don't have to scramble on the first day of classes?
I think that's great advice anytime, especially for first year students or second year students, even sometimes who may not know campus as well. This year, of course, some of the students who are now second year students didn't attend classes last year or all of last year. So again, just going back and I think, re-examining campus and see what's happened. If you haven't been there recently, there are 2 major construction sites going on campus. So again, some of the routes that you might have normally taken might have to be, rerouted. So thinking about those issues would be important. And then again, looking where the resources are, like if you need or potentially need access to student wellness, knowing where it is and so that you can get there during office hours would be useful too.
Of course, and the other thing you mentioned was the importance of exercise. So maybe looking at going to the facilities in the kinesiology building to see what the hours of operation are. So that can be part of
September 7th is when they open again. I've just been checking this recently for myself. So September 7th, and the indoor facilities will be available. You have to book a time because they are limiting access numbers, at least for the beginning part of the fall, and then they'll monitor how things go.
One more question related to going back to campus really relates to the fact that we will be around a lot of people. And most of us have been in this two-dimensional world for 16, 18 months. Yeah. And it's going to be a different experience. So how do you manage, that anxiety around going back onto campus, being around a lot of people? A, B, it's wearing, it's tiring because you haven't exercised that social muscle in the same way. Yeah. So thoughts on what we should do about that?
Yes, yeah, that's a great question. The one thing, again, I hinted at this earlier, so I'll be more explicit now. Anxiety can take different forms. So again, we talk about generalized anxiety, which is this broad, pervasive sense of dread. We also can have more specific forms of anxiety, so health anxiety. So some people may have concerns about actually being around people who are infectious and developing COVID-19. So this may be people with immunocompromised conditions. It may be people with children at home, for example, that they're afraid about bringing COVID-19 home. So this is more like a health anxiety. That has a different kind of reaction than social anxiety. So social anxiety is more the concern around being with people and the reactions of having interpersonal issues. So one of the things I would ask people to do is if they're feeling anxious or nervous around different situations, try to figure out what it is that makes you nervous. Is it the concern about infection itself and the vaccine rates, or is it about being with other people? If it's about being with other people, I think that's reasonably easy to manage, because the general recommendation would be to think about a series of steps. This is, again, as a psychologist, the kind of way we would approach this is designing a series of hierarchically developed or increasingly difficult social situations, and then try to expose yourselves to them. So it might be a short interaction first with someone. It might be imagining a more difficult interaction, but not actually having it, then trying to have a more difficult interaction, potentially talking to a professor, confronting somebody, again, sort of thinking about this hierarchy and then going through it. So approach the situations that you're afraid of. For health anxiety, again, I think it's a little bit different because it's realistic to have some health anxiety around a potentially deadly virus. And so again, I think there I would recommend people follow public health guidance as much as possible. Again, the university has been very good in recent days about recommending that everybody be vaccinated or get tested. And that, again, I think this guidance may change within the next little while. But again, to the extent that we can wear masks, engage in physical distancing, follow best public health guidance, this will try to manage, I think, some of that anxiety, the health anxiety.
Do you have any tips in terms of how we can signal our comfort or lack of it in terms of being around people? Again, same story. Haven't been around people. How do we signal that we're not
Yeah.
happy being close to someone?
Yeah. One, again, I guess it depends partly on the individual making the request. I mean, if you have been double vaccinated yourself, and if you feel comfortable, I think you should absolutely feel the right to ask somebody if they've been double vaccinated as well. And they can decline to respond, of course. But I think most people will tell you if they have. And again, with the guidance on campus, either we will know that people are double vaccinated or that they have tested negative based on the last information I've seen. So we can have reasonable confidence that people are going to be safe and secure on campus as much as possible. But I think you absolutely have the right to ask. I know there had been some talk in some places about having wristbands or things that people can wear, that are going to indicate their vaccination status, and I don't think that makes good sense at all. I think that potentially opens up us versus them, and the potential for stigmatizing people that have different colors, for example. So I'm pleased that our university is looking at it, something like that. But I think, again, the best we can do is express our concern, talk about our feelings ourselves, take ownership, for our own desire to know, and then ask. And if people won't tell you, then I would say you have the right to step away and not to engage as much.
I guess that, it also raises the possibility that someone who says they have a negative test and they haven't been vaccinated, and then that could start a conversation that could be very uncomfortable. How do you suggest people deal with those situations?
I would suggest you practice having these conversations at home in your head or with people that you know about, so that you're ready for when these conversations do happen, because they almost certainly will happen. And again, I think with the best guidance that we have right now, again, people can be reasonably expected to be vaccinated or have a negative test. So it shouldn't happen very often, but when it does happen, again, I think you want to take responsibility for your own feelings, your own actions. You can say that the university's guidance is that we should all get vaccinated, that the university is making it available. I understand there are going to be clinics set up on campus to make it as accessible as possible. And just encourage it. There was some data that came out last week. It was a survey of faculty and staff, and it suggested that about 93%, I think, of people who responded to the survey said that they were vaccinated now. So again, I think we can have reasonable confidence that most people will be safer. Again, we can't say safe because, of course, even vaccinated people can develop COVID-19. But again, that we'll have as safe an environment as possible.
So just, we still don't know if everybody's fully online because there's going to be some decisions made. If you're a student, how do you manage that disappointment potentially of looking forward to being on campus, being with your classmates, and then facing that potential that you may not have that opportunity?
Yes.
And that's going to affect your sense of, your experience and your well-being. I mean, and you can't control that.
That's right.
So.
And my understanding again is that most students, again, from the surveys that have been done, want to be on campus. They want the university experience. They want to interact with faculty members or, their colleagues, colleague students. And so I think to the extent that we can all work to ensure that that's as possible, it would be to the better of the university overall. So again, I think it's up to all of us to be respectful of the fact that some people are going to have problems from time to time. There will be outbreaks, almost certainly, somewhere on campus and in different settings around the city or around the province. And so again, there will be some fluidity, but to the extent that we can be respectful but approach people in a positive, supportive way, I think that's the best we can do.
And how should professors create a welcoming and safe in-person classroom environment that validates everybody's concerns and space and comfort?
Yeah, I think you have to address this. It's like the elephant in the room, of course, and everybody knows it's there. And so I think we all need to be, again, open and honest about the fact that there is some anxiety. Again, as an individual professor, of course, you may have some different feelings or thoughts about your own vulnerability or your own situation with respect to COVID-19. You should try to keep abreast of the university policies and procedures. So again, that we all know what's available, from a health perspective. We should know what the resources are so that students can access those resources if necessary. And again, I think it's incumbent on all faculty members to be supportive of the students who might be feeling distressed themselves and let them know that there are services available. We don't all have to be psychologists, of course. We don't all have to be doing mental health assessments for our students, but I think letting them know that you are listening and you're compassionate is important.
And what if, as you said, there will probably be outbreaks on campus that could increase the anxiety level across the board for everyone? And is your advice to just be aware of the directives and the messaging from the senior leadership team on this? Or how do you sort of deal with your own reaction to an outbreak?
My own reaction or the institutional reaction?
Well, I think that, if you're a student, if you're a faculty member, how do you deal with that?
Yeah.
Do you shut down your classes? Do you stop coming to campus? Do you carry on as you were? What would you suggest?
Yeah, again, I think what we want to do is probably follow the best advice at that time. So for example, I could imagine, again, I hope this doesn't happen, just to be very clear, but I could imagine, for example, an outbreak at the recreation center, for example, and again, there may be some short-term or longer-term closures of some facilities in the rec facilities. So again, if you go to campus rec facilities thinking you're going to exercise and you find out it's closed, obviously you'd want to get the best information about what it is and how long it's going to be, and then respond. It could be that there's an area of campus, like a whole sector, that gets closed down for a period of time. So again, we just need to, I think, be mindful that there may be some need for flexibility here, that we want to keep up to date with the best possible information. And then my own opinion and my advice to everybody is to get back to campus as soon as you can, as soon as you feel comfortable. Interact with others to the extent that you feel comfortable and that you're willing and able to have those engagements in the way that you feel safe. Again, so again, you may be wearing a mask or you may be engaging in physical distancing, but do it in a way that you feel as comfortable as possible and get there as soon as you can. Because I think in terms of reducing your anxiety, that's going to be the best long-term strategy.
So this is the elephant in the room question, and that is how to handle others who express anti-vax, anti-mask sentiments. And some people who may say, well, I did have COVID, I didn't get vaccinated because now I don't need to. Do you counter that with factual arguments? Do you just choose to not engage and say, we have a difference of opinion, I'm not comfortable, I'm leaving? Like, what would you suggest?
Yeah. So again, this experience shouldn't happen terribly often on campus if people do follow the guidance, that the university is now giving. And again, one of the things I'll say about guidance from senior leadership is, if I was giving advice to senior leadership, it would be to be as consistent as possible. I think one of the most damaging things we've seen during the COVID era has been shifting public advice, and part of that, of course, is new information, new data,
Right.
that leads to changes. But some of it has just been quixotic, sort of things that it's very difficult to understand why guidance has changed. So again, be as consistent as possible to provide a safe and secure environment. But I agree with what you were just hinting at, which is that if somebody is expressing negative attitudes about vaccinations, for example, and you have a different opinion, just say, I don't agree with you. We have a different of opinion here. I'm not going to try to change your mind. Again, depending on the interaction, that's probably not what's intended. So I would say just, I don't agree with you, and I don't want to have this argument. So walk away.
You just touched on something else. We keep seeing the directives change. Every week there's new information, there's a new study, there's something else that's coming out. And then things, what we thought was in place has changed. So I'm just going back to those graphs that you showed at the beginning, that the rate of anxiety and depression pre and post pandemic. How do you see, this is a very real possibility that we'll continue to see this uncertainty in terms of how we manage and what we're told to do. Can you connect the dots in terms of how you see that manifesting in the anxiety and depression statistics, even though we're sort of back to normal in terms of the fact that we're now, we are back on campus and doing some things that we used to do before?
Yeah, so one of the things I would say there is that when we think about the psychology of different emotional states, they have different orientations towards life stressors. So for example, anxiety tends to be a future-oriented emotion. We get anxious about things that are coming down the line, that we don't either know what they're going to be or that we think we may not be able to cope with. Depression and anger, for that matter, tend to be past-oriented kinds of reactions. So typically we get sad about things that we've already lost or feel that we've lost, or we get angry about situations where we feel somebody's imposed a situation on us or disrespected us. So, but again, typically these are events again that are in our rearview mirror, so to speak. So one of the things that I predicted when COVID-19 began is that we'd see a huge spike in anxiety early on, and that depression and anger and other responses would sort of follow along. And that happened to some extent, but we're now 18 months in, and of course we've been having waves of anxiety, and it looks like the depression levels are actually fairly stable. So anxiety does seem to be still moving somewhat with new circumstances or changes in events, but depression levels seem to be pretty stable. And depression is typically associated with loss, not always, but loss of opportunity, loss of employment, loss of income, death, of course, loss of a loved one, again, in the extreme. So again, not surprising that those losses haven't really changed that much over the course of COVID-19 once they started to happen.
Can you talk a bit about the importance of language in terms of how we express how we're feeling? Because somebody might say, I'm depressed, or you're depressed. And really what it is it needs to be a conversation about the feelings that are underlying that one label. Can you just sort of go down that path a bit, and so that we can be better at supporting people who may manifest or think they're manifesting in a certain way?
Yeah, there's been a lot of discussion about labels and terminology, in the mental health field. And again, we run into some difficulties ourselves. So the word depressed, when you just mentioned, is actually a shorthand term that clinicians will use when they talk about somebody who has a diagnosable mental health problem, clinical depression. So we say they're depressed, but it's also used in common language, when you're feeling down, or even if you have a whole cluster of signs and symptoms. So what I would encourage people to do is, rather than being amateur diagnosticians or trying to provide a summary label for how they're feeling, which is convenient. And again, that's why we do it partly, but pay attention to the actual signs and symptoms that you're feeling. So notice your feeling, notice your behavior, notice, your coping resources, what you're doing to manage your feelings and so on. So think about it, if you can, more in a more complex or more complete way, because it may be, for example, that your feeling of sadness is going to take a little while to respond, but you may be able to take an action very quickly. So you might be able to do something positive that's going to longer term change your feelings. So again, if you can pay better attention to what it is specifically you're dealing with, then that's probably going to give you some clues about ways to cope or modify what you're doing.
Can you speak to the languishing conversation that has started to sort of gather momentum in the last 6 months, I would say, in terms of, they call it the middle child of mental health, and whether, where, if you
Yeah.
sort of identify in that space, what should you do so that you don't progress down the continuum and become sort of clinically depressed?
Yeah. So again, the mental health continuum model that I presented earlier sort of recognizes this idea that people can be, within that framework in the yellow or orange zone, having some signs and symptoms and struggling. So again, as I said earlier, I think the important thing is for us to notice, to be aware of what's happening. So people that are listening to this talk, they could potentially go back and get that continuum model and see where they are. And if they're shifting over time, then that's a sign that they should be taking some action. And what that action will be, of course, is going to vary. So it could be coping with a specific problem. It could be, the health of a loved one. It could be having a child, and having the anxiety around their return to school. So
Sure.
getting information about school policies. Again, so what the appropriate coping response is going to be is really tough to say in general. But again, the self-assessment and the honesty with oneself and with others, like I said earlier, naming the problem and then addressing it as positively as possible.
And the question's been put in the chat about, how does somebody help a spouse if they have depression and are resisting help? What should they do to lead them in the right direction?
Yeah. So there was one slide again on my series talking about, if you see the signs, take some action. And again, I would just go back to those kinds of points. So I don't think your job is to diagnose your partner or your spouse. Your job is to say, here's what I see. Here's the impact potentially either on them or on yourself or your relationship. So identify what the issue is. If there is stigma going on, so if the person is self-stigmatizing,
Yeah.
or is saying that they don't believe that they deserve resources, or
Right.
that this will pass, try to
Yes.
address those kinds of concerns, and then try to engage resources as best you can. Unfortunately, there are some people who will know that they're struggling with mental health problems who won't take action. And in fact,
Right.
it may be part of the sign and symptom of their mental health problem that they're feeling avoidant or feeling, lethargic, or that they can't cope. And so again, sometimes engaging resources for people is something that's very helpful as well.
Is that something that you should do on their behalf?
If they're in agreement, I would say absolutely.
Yeah.
Again, I don't think you want to take responsibility away from the person, especially if they're an adult. Of course, you would hope that they would be able to do things themselves. But for a period of time, maybe they don't feel able to make the phone call, to get access to a physician's appointment. So maybe you'd be willing to do that for them. Again, I don't think that's a good long-term strategy for sure. But for the short term, it may be something that would help them get over the hump and get the resources that they need.
The tough part is sometimes getting people to understand that they actually are presenting the symptoms that people are seeing, but they don't see them themselves.
That's right. But that's what I say earlier. I think the early part of that conversation should be what you observe,
Right.
and again, not your inference, not that you think that, they're denying reality, or, that, what you think may be going on, but just rather, what have you seen? And then why is it a problem?
So what signs should we be looking for in others that might flag that they would benefit from support? Is that back to the continuum, or just sort of seeing how, yeah.
I would say it goes back to the continuum. And again, like I said earlier, I think one of the common signs that we see in our society is the pulling away. Again, I talked about the fight, flight, or freeze when people get stressed. And again, oftentimes what we see in the early days is where people will sort of stop what they're doing. They may look around for information or guidance from other people, but often they just sort of freeze and they don't take action. Sometimes they may actually run away, but most typically you see avoidance or withdrawal.
But could you speak to the fact that, COVID and the isolation has given a lot of people license to withdraw?
Yes.
And so it's something like what's the balance point in terms of where you actually say you have withdrawn, and it's not about COVID, it's about other things. And that's a tough conversation to have, I'm thinking.
Absolutely. And this goes back to, again, some of the language I think that we've used. So like I've said before, I think we absolutely should never talk about social distancing. Physical distancing may be publicly recommended, but we need, and again, all of us vary somewhat in our social desires, how much we want to have contact with other people. But all of us are social animals, and we all need contact with other people in one way or another. And certainly if we're working at the university is a social environment, social enterprise. So we have to interact with other people. So again, I think as best you can in whatever way feels comfortable for you, that you should maintain contact. It could be phone calls, it could be Zoom calls, it could be this meeting. Again, there's many different ways of having social contact, but again, to the extent that you can normalize them, I think you'll find in the long term the better. Again, I'll just give a personal revelation here. I've been going to campus and actually interacting with people on campus in the past months. And the campus is open now, of course, and so people can do that. And I think if you feel comfortable and are ready, like I said earlier, I think you want to get back to campus as soon as you can.
What about some of the systemic things that we could address in the context of mental health? I mean, a lot of what we're talking about is really on the individual, what we need to do ourselves. Are there systemic barriers, changes that we could look for and make changes so that it's a little bit, that supports better, and it's just something that we don't have to deal with in this way that we have been?
I think absolutely. And again, one of the ironies, I think, of COVID-19 is that it's allowed a lot of discussion about mental health problems that people have, and identification of some of the gaps of services that exist. Like I said earlier, University of Calgary has been one of the leaders countrywide in terms of developing a mental health strategy for students, faculty, and staff, so for the whole community, and has been recognizing some of these issues. We've had access to programs that other places don't have, and our wellness services is very well developed for students. We have a good set of EFAP and other services for faculty and staff. So I think, again, that we've done reasonably well. So some of those systemic barriers are certainly gone. At the broader level, at the social level, community level, we still have some significant problems for people that are struggling with mental health issues. There are still significant wait lists, wait times to get access to specialists. The range of services, in my opinion, in Alberta is not what it could be or should be. We have relatively few specialized mental health services, for example. We have some, but not as well as could be developed in a province as large and as rich as ours. But again, those are broader systemic issues that the university can't solve, unfortunately.
So we're back on campus and you see a classmate that you haven't really been interacting with, but as part of your cohort, you don't know what their journey has been, and they don't know what your journey's been. How do you make sure that you engage in a way that is respectful and sensitive to the fact that, you've had different experiences most likely, and you've coped differently? Do you have any thoughts on how that should be?
How you could do that? Yeah, I think one of the things that we can do is, again, be caring and compassionate. So, recognizing just the question that you just asked, recognizing that people do have different journeys or have had different experiences, and we don't know unless we have the conversation. You can model, I think, open communication yourself, let people know what your experience has been and how you've coped. If you've been feeling anxious, and talk about some of the ways you've coped with your own anxiety, for example, that would be entirely appropriate. But again, I go back to the idea that if you're seeing a friend who may be struggling, or colleague who may be struggling, if you have the caring and concern, then to say to them, this looks like what I'm seeing. Is that right? Is there anything that I can do to help you? And again, do it in a way that's respectful, and if you can, private, so that you're not embarrassing them in a social situation, for example. But again, if you can and you feel comfortable having that conversation, do it. And then, of course, check back later.
Yeah, I mean, we just don't know, like I said, we just don't know what everybody has been doing. So one of the things we talked about probably on the first webinar was the unpredictability. And it was one thing to say, we know this is going to be over in a week. And now it's, almost 18 months later that we've been dealing with this. So my question to you is, are we coped out? Do we have reserve to continue to cope? Because we know that there'll be some curveballs that come down the way in the next few months. Where are we getting the reserve from?
Yeah, I think some people are at that point, feeling fatigue, compassion fatigue or COVID fatigue, without a doubt. But like I said earlier, I'm always amazed at how resilient we are as a species. People seem to be able to bounce back from horrible disasters, again and again. I don't know where that resource always comes from. I do know part of it, though, is definitely having social support. In fact, there have been some studies, I didn't talk about this earlier, but there have been some studies during COVID-19 looking at social contact and social support as a buttress or as a resiliency factor to reduce anxiety and depression. And there's no doubt that that's true. And this is not something new, not something we just learned. But again, there have been studies in the context of COVID-19 that improving social contact and social support is a significant way to feel better and to feel like you have more resource. The other thing that it does, of course, is it gets you outside of yourself and helps you to focus on somebody else. And again, people may be feeling very fatigued about their own resources and what they can do for themselves, but when they're confronted with a social situation, sometimes they can step up again. So again, I would just say, keep engaged as best you can, and then use your current situation as a ladder to the next step and move forward.
So some people are not as comfortable when others are as open with sharing their feelings, and their reaction may be one to A, shut down, B, just not engaged. If you're the person who's opening up to be vulnerable and the person you're talking to is not able to help you, how do you need to protect yourself?
Yes. Yeah.
And so what do you do?
And again, I think you have to recognize that whenever you take that risk, you take the risk to be vulnerable, you may be satisfied, you may get that need met, but you may not, and again, it is a risk. Again, there's an irony, again, in another context, but in order to know you're truly loved, you have to take the risk to be rejected. Right. So you have to get into a social situation where you could be rejected. And it's the same, in order to know that somebody is going to potentially listen to and care about you, you have to take the risk and be somewhat vulnerable. If you find that you are disappointed, that's obviously unfortunate. It may be something in the way you've expressed yourself. It may be something about the other person. But again, I would encourage a person in that situation to try again, give it a second chance with another person perhaps, or maybe think about, again, a different way to express the concern. I think where that becomes really problematic is if, for example, it's with an intimate partner, so your spouse or partner, and you open yourself up to them and then they don't meet your need, then that's potentially more problematic. But if it's a colleague or co-worker or somebody in the work environment, again, I wouldn't normally expect people to become very compassionate and, and again, in some ways you may not want that. You may not want to be touched, for example, or consoled in different ways. So again, think about what it is you're looking for. And again, maybe express that too.
And just do we still see the online social support as something that's something that can substitute, or is it we're just talking about in-person connections?
Both. And again, I think different people are going to be at different stages, in terms of their readiness and willingness to engage. And again, I think what the individual needs to do is think about their own particular situation and what they're comfortable with, reach that, and then, if they can, move it to the next level and the next level.
So I know we're supposed to be talking about campus return to life, but I know that there are people on the webinar that have kids that are going back to school. And I'm wondering if we could just spend a bit of time talking about how we help children going back to school and what they need to be thinking about to help them be successful as they go back into the classroom.
Yeah. So I would say a few things. One, I think, again, just as with ourselves, we need to be open and honest, but where we are, we need to be open and honest with our children, let them know that it's okay to be anxious or worried, that they may see things again in the school situation that are not ideal, and have them anticipate what those feelings may be for them. to develop maybe some coping strategies again. So how do you talk to children who may be denying, the importance of COVID-19 or may not be wearing their mask appropriately, because it looks like, again, schools are going to mandate masks. So having those conversations, I think many people at this point are pretty used to having those conversations.
Yeah.
We've all been doing it for 18 months or so. But again, as the mandates change and as the social policies change, again, helping the children to stay aware of what those are, what the current standards are, and feeling comfortable to talk about their own feelings and needs, and then, to respond to other people. I think that'd be the best thing that we can do.
And is there anything?
Sorry, I was just going to say the other
Yeah.
thing, the other piece of advice, just generally, I would say for people who see children going back to school, and again, I think we know this from a lot of the work that's been going on now, is that social isolation has been damaging to the mental
Yes.
health of a lot of children. And again, my general advice, and again, you have to nuance this by the person's situation, but my general advice would be get them back to school as soon as you can, in a safe, responsible way.
And so, when you say it's been damaging, the isolation, and so that sort of suggests that their skills, their social interaction skills may be a little bit off because they haven't had that opportunity for the last 16 months. I'm wondering if you have some suggestions that parents could prepare, maybe teachers could think about, and so that everybody feels a little more comfortable and perhaps less awkward.
Yeah,
teenagers are awkward.
Yeah. Well, there are two age groups that I've been most concerned about, and I've actually expressed this before. One is sort of the kindergarten age, grade 1, grade 2. Again, much like first year, second year university students.
Yeah.
They need the socialization into the educational system, and they haven't had that. And so, again, I hope again that schools and teachers are thinking about the best ways to introduce social behavior and appropriate social conduct, and modeling that for their students as well. But for parents, especially who have children in that age group, I think, again, having more conversations about what a successful move to school looks like is important. The other group is the teenage, the dating and mating kind of group. And again, they've lost the social opportunity to have intimate relationships. And again, I don't mean physically intimate, but, it's emotionally intimate relationships. And again, developing those skills, I think, is something that's going to take some time. So again, I think parents who have children in that age group, as much as you can, you want to be open and honest and, facilitate those discussions with your children.
Well, we're almost at the top of the hour, and I just want to reiterate something you said at the beginning. We have to stop meeting like this online.
Yes, I agree. Yeah, for sure.
Be nice to do one of these in person, and hopefully we'll be able to do that in the fall at some point. But I'd like to thank you very much for your insights. As always, walked away with a lot of very interesting perspectives and ways to cope as we move forward. So I'm going to turn it back to Melissa Boyce, and she's going to close off the webinar. But thank you very much for doing this.
Thank you. And thank you for the questions. They're very good.
And thank you. That concludes the last session of the 2021 Summer Wellness Series. On behalf of the Taylor Institute for Teaching and Learning and the Campus Mental Health Strategy, I want to thank all of the participants who joined us today. And a big thank you to Chancellor Yedlin and Dr. Dobson for facilitating such a wonderful session. The recorded video of this session will be available on the Taylor Institute website within a week or two, along with the other sessions from this summer series. Please take a look, Dr. Dobson, if you have additional resources or events to share. You're good? Okay, nope, never mind. Then feel free to check out the Taylor Institute website for upcoming campus events. Thank you for joining us today, and have a great afternoon.
Thank you.
Thanks, everybody.
Thanks.